So hi everybody, welcome to Dr. Fred's Kitchen. So here's the thing, anybody who knows me knows that I believe you should go to the most experienced people for the things that are important for you. So I go to a good mechanic when I want my car fixed, and I go to a plastic surgeon for things that involve plastic surgery. So one of the things that is going on now are these things called these Hyaluron Pens. So we have a lot of patients asking us about these, whether they should get them. So we're going to pit this thing. This is the thing. We bought it straight from Amazon, which is a known medical supplier of quality goods, with an old-fashioned syringe. Now I contend that if I put filler in appropriately with one of these, that I can be much more creative, much more artistic, and much more precise. And that this is like hitting a lip with a bazooka, which I'm about to show you. All right, so now to begin our experiment, we're going to start with this lovely Asian pear. So here we're going to take the Hyaluron Pen. I don't know if this is actually the brand name, but it's the same thing. And this is our bazooka. Oh, by the way, you have to cock it. You believe that? So here we go. We cock this thing. And just a piece of advice, if any of your medical instruments need to be cocked, I would not be aiming them at your face. And then we're going to shoot this in as if it was someone's lip. Look at that. So that's what would happen if you would have this little bleb of whatever they put in there. And that's the other question we're going to get to. What are they putting in there? Because they're not buying filler like plastic surgeons buy. They're not putting in Juvederm or Restylane. They're putting in some no-name hyaluronic acid, which you don't know where that comes from. And we're going to take a knife and cut it open right through the place where we shot. Look at that. And look at that. So you tell me, how is that a precision treatment? This doesn't seem like I would want this aiming at my face. You know, the FDA has already said that this should not be used. And they've done the research. They get tons of complaints about it. But I just want to be clear that it really is not an instrument that is going to give you the precision that we can with a syringe. So let's try that. So we're going to take the same pear. We're not moving it. There's no sleight of hand here, right? We're going to take a little needle, inject it as if it was a patient. Just a little blab, honey. We'll dab it. Okay. Get the old pear juice off. And now that, let's take a look at it. This thing just spreads like crazy. This goes exactly where the syringe went, exactly where I wanted to place it. So the point is that this is your face. These are your lips. The lips probably is one of the most delicate and fine features of your face. You want them to be sculpted by someone who knows what they're doing. So the idea that you can do that with a blunt instrument that was used to deliver vaccines in the 1920s makes no sense at all. So I'm not trying to put anybody down, but I do care for the safety of our patients. I'm not asking you to necessarily come to me, just be careful out there. You know, it's like the Wild West. So good talk. See you soon.